everyone. We are in the process of reconvening. We're asking everyone to take their seats. Thank you very much for allowing us the opportunity to have the executive discussion. We are now moving on to the state board priorities. And the first item up is a monthly report on school logistics and transmission rates related to COVID-19. That's under tab F. There's updated material in your folder. Superintendent Chaudhary, I believe we're going to start with a video from the health department. We had invited the health department to come and they have submitted a video for us to give us an update from their perspective on the current situation with respect to COVID.
Absolutely. Thank you, President Crawford. Mary Gable will be joining me for this presentation, but we're going to kick off things with the video provided by Dr. Chan at the Maryland Department of Health that will cover the current state of COVID-19 in our state, and as well as other metrics related to vaccinations and also just lessons learned to date. And so I would ask that you carefully look at this presentation, and then Mary will take over from there, and then I will also join her as during parts of the presentation. Thank you.
Very good. Thank you.
Hello, and good morning to Chairman Crawford and members of the board. My name is Dr. Jin-Ling Chan, and I'm the Deputy Secretary for Public Health Services with the Maryland Department of Health. I am pleased to provide an update about the state of the pandemic here in Maryland for you this morning. I'll be talking a little bit about national and state trends, as well as the COVID-19 impact on children, COVID-19 vaccinations, and then providing a perspective on the COVID-19 pandemic as we are approaching 2 years in the state of Maryland. So the current status here in Maryland is that we have the lowest case rate in the country, with a 7-day average daily case rate of about 11.5 cases per 100,000 population. We are now, fortunately, on the back end of the current 6th wave of cases that was primarily driven by the Omicron variant. Our first case of Omicron was identified on December 3rd, 2021, here in Maryland. Because of how highly transmissible this variant is, even more so than the Delta variant, it quickly overtook Delta as the predominant strain. We saw a rapid increase and decrease in cases across the state. We reached a pandemic high of nearly 18,000 new cases of COVID-19 reported to us in a single day during the first half of January. It unfortunately also caused the highest number of daily COVID-19 related hospitalizations and deaths reported to date, which I'll talk about a little bit more in a moment. We are continuing to monitor other variants that may impact us, such as BA2, which are variants related to Omicron. However, as we have seen, it has been difficult to predict which variant will become the next one that impacts us. BA2 has been detected here in the U.S. and in Maryland with about 20 cases here so far, and according to the CDC, it now comprises about 4% of the cases sequenced here in the United States. While it is more transmissible than the Omicron variant and has driven other case increases in other countries, such as in Denmark and the UK, we have not yet seen the cases of BA2 rapidly increase like Omicron did in December. With much of the population having been vaccinated and also infected with Omicron recently, it is thought that the immunity from both the vaccine and the recent Omicron infection will prevent significant impact of BA2. We will continue to stay vigilant for the spread of this and any other future variants here in Maryland. So this graphic shows COVID-19 related hospitalizations since the beginning of the pandemic. It is illustrative of the overall pandemic curve that we have been latest wave, driven by this Omicron variant, was the most impactful. At the peak of the Omicron wave just a few short weeks ago, there were 3,462 adult hospitalizations and 61 pediatric hospitalizations in Maryland hospitals, which occurred about mid-January. In order to understand how effective vaccines can be in helping us to achieve our goal to prevent significant disease and severe illness, it is important to note that between January of 2021 and January of 2022, approximately 80% of COVID-related deaths in Maryland occurred in patients who were not fully vaccinated, meaning they had not completed the full course of either Pfizer or Moderna or Johnson & Johnson. The data show a similar trend where hospitalizations are higher for people who are not fully vaccinated than they are for those who have received a full vaccination. Maryland has seen a rapid decline in the Omicron-driven wave of cases, as you can see here in the graph, but we do continue to focus our work to ensure that we are prepared to respond for the next potential wave. This map from the CDC website shows the community transmission levels in Maryland by county based on CDC's designations that take into account both the weekly case rates and test positivity, with red showing high transmission, orange indicating substantial, and yellow indicating moderate community transmission level, as we see here in Prince George's County. While having the lowest case rates in the country right now, Maryland as a whole is still experiencing substantial spread according to the CDC, with differences across the state as you see here. It is important to note that CDC actually calculates their case rates using total weekly case counts, while MDH has always used daily case counts, then averaged over 7 days. So this accounts for the fact that our case rate figures that are published on our website, coronavirus.maryland.gov, are not directly comparable to CDC's metrics, which I know can be a source of confusion. So since the last update I provided in November, we have seen this Omicron variant impact our state, including children. In December and January, we saw higher case rates among children who were younger than 18 years compared to even to the case rates among those who were older, greater than 45 years of age. In addition, we also saw a higher number of children being hospitalized during this wave than previously, with over 200 hospitalizations among children in January alone. Among about 75% of those hospitalized had actually not been vaccinated, so meaning they had not even gotten a first dose of vaccine. The key message here is, again, vaccines work to prevent even kids from getting severely ill. This is the fundamental reason why my husband and I chose to get our kids vaccinated, including our little 6-year-old, to reduce the potential harm that COVID infection could potentially cause in him. I want to shift now and focus for a moment on our vaccination program. So in Maryland to date, over 11.4 million doses of vaccine have been administered, including 2.1 million booster doses. Across the state, 73.7% of the total population have received the full primary series or are fully vaccinated. This means 2 doses of Pfizer or Moderna vaccine or 1 dose of the J&J vaccine. This ranges across the state from county to county, anywhere from 49% up to 85.2% here in the state. These figures are higher overall compared to the U.S. as a whole, where only about 65% of people are fully vaccinated. This map of the United States is taken from the CDC and shows the relative vaccine uptake rates by state, with darker green indicating greater percentage of uptake. As I had indicated before, Maryland is at about 73% right now and is among the states with higher uptake of vaccines. When you look at COVID vaccine uptake among children and adolescents, this includes individuals who are 12 to 17 who've been eligible for COVID vaccine, or at least the Pfizer vaccine, since May. And for those 5 to 11 years old who've been eligible for vaccine since November. So among those who are 12 to 17 years old, about 74% have received their full primary series, or again would be considered fully vaccinated, and 36.9% of those 5 to 11 years old have received theirs as well, with a range again quite broad across the state, anywhere from 9% of 5 to 11-year-olds in one county up to 59% in different counties. Keeping in mind that this campaign for 5 to 11-year-olds began right around just before Thanksgiving in early November. So we clearly still have some work to do to have more children vaccinated across the state and protected. I wanted to talk for a moment about some of the vaccine developments that are on the horizon right now. Pfizer is in the process of collecting additional information about a potential booster for those ages 5 to 11 years of age, just as they did for ages 12 and up, and there is actually a booster recommendation for those 12 and up now. Also, you may be aware that FDA recently delayed their consideration of the Pfizer vaccines for those 6 months to 4 years of age to be able to consider additional information that's being collected right now in clinical trials about the efficacy of a potential third dose in that age group. I just want to mention that the dose for this age group is actually smaller than the dose for the 5 to 11-year-old vaccine and the 12 plus vaccine. 2 doses, it's similar in terms of having 2 doses given 3 weeks apart, but a third dose is being investigated right now, which would probably be given about 8 weeks later. The initial data that has been shared to date, and it's important to keep this in mind, safety being the most important thing that we are always looking at, that this vaccine in that younger age group seems to show a very similar safety profile as we have seen in children 5 and up. So I wanted to close by talking about the pandemic from the perspective of someone who's been involved in the state's response efforts from the very beginning. It has been 2 years since the U.S. reported its first confirmed case of COVID-19 in January 2020, and nearly 2 years since Maryland had its first confirmed cases. Since then, we have all gone through, together, the ups and downs of the pandemic, with none of us at this point unscathed, and nearly 14,000 of our family members, friends, and neighbors who lost their lives to COVID-19 infection, and countless others who may have died because of delayed care. Everyone is fatigued and tired of the daily stress of managing the impacts of this pandemic on our daily lives, or in many cases, even hearing about COVID at all. And I get it. It impacts me and my own family every single day, just as it does for families across the state. However, as the COVID virus continues to evolve and we learn more about how it affects our bodies and how it infects us, we also must take into account how it has had other impacts to us all, including our children's opportunities for learning. So, what have we learned 2 years ago? First, vaccines work to protect against severe disease and death from the infection, even after natural infection. Now, natural infection can induce immunity, absolutely, but it is not sufficient alone. And so people who may have gotten infected last year or early in the pandemic in 2020 should still get vaccinated because that immunity is not lasting. In addition, access to testing, as in the very beginning of the pandemic, is critical for families to be able to make informed decisions about isolation and quarantine and to reduce the risk of in-school transmission. At-home tests that are simple to use are more available now than it was even 6 months ago. And for free in many cases, either reimbursed by individuals' health plans that they might have for their families, or still available through local health departments. Other layered protections, including masking and day transmission rates. I would emphasize that there has never been any single measure alone that has been recommended by MDH or the CDC to decrease transmission in schools or in the community, including the masking. On the contrary, it is the combination of protective factors and activities that can minimize, though never eliminate, the risk while balancing the educational needs of all of our children. So given what we know now about this virus, there is no single 100% solution, as many have been seeking. At this point in the pandemic, we do have all the tools we need to keep kids in school safely. School and education are paramount, and schools should remain open with very, very few exceptions. So I want to thank the board for their attention, appreciate the opportunity to provide this update to you, and thank you for your time.
Well, we appreciate Dr. Chan's update. At this time, what I'd like to do is to now turn back.
You're seeing is by county, not just by state. And we'll be looking at nationwide trends. So where are we with vaccinations? This is a summary of what you've seen before, but we always look at it just to see if there are any changes. At this point, there were no changes here. This is vaccination is required for all staff, including educators. You can see that in the graphs on your left, that 5 do and 19 do not. Proof of vaccination is required for educators, and you can see those graphs on your right. COVID testing, this was as of February 16th. Local school systems had the ability to update. Is COVID testing required for all staff, including educators, if not vaccinated? You can see the results of that, yes, of 6 and 18 for no. This chart that we have been showing you is the reported, self-reported by the local school systems of their percent of teachers that are vaccinated. Just to let you know what the results are since the last time you saw this a month ago at the board meeting. Caroline County has gone from 65 to 70%, which they reported before, to a little bit lower, 62%, and the reason for that is, as they explain, it is about just fine-tuning their data and getting in and making sure the accuracy of their data. So that's a slight change. Harford County has increased from 59% to 74%, and Queen Anne's County is down a little bit from 85 to 78. Again, when we checked on that, they explained that it was accuracy of their data and checking it and double checking it. We're now going to look at screening, testing, and contact tracing. These are definitions, just to, it's always good to just reflect and remind ourselves of the definitions of the different testing. Diagnostic testing, here's a situation of giving the test if an individual, student or teacher, could be, or an educator, has displayed some sign or symptom. A screening test could be for unvaccinated or vaccinated, but it's looking at asymptomatic. So it could be on a regular basis of some sort that the school system is conducting screening testing. And then there's last described here, test to stay. And in some cases, you're going to hear it's called test and stay, but that's state-driven. This is a practice of a student who may have been exposed, and there's a regular testing. Could be every day for a week. It could be on another cycle. MDH has increased, as you know, and this was in the midst of, and we're showing this in the midst of Omicron, when there was a need and everyone was trying to get a test, and an increase that was announced by the governor, and an increase in sites. Now, pretty much you can go. Many places still require an appointment, and others do not. So what, if the Maryland Department of Health has had a strong COVID-19 screening program that began in the last school year, available to local school systems. Since July, they've offered the opportunity to local school systems and to non-public schools that you can contact them and participate in a testing program. Could be screening, could be in along with the diagnostic testing. There is an application, and it does end up that you're working with a vendor, and you can see in the bullets at the bottom what the vendor will provide. They will, in some cases, come in, conduct the assessment, provide staff, transfer the results transfer the test to get to the laboratories. We gave you at the last board meeting an update, and I just worked with MDH to get the latest update. They've said in this school year, MDH has conducted almost 1.5 million tests. Since the start of January, 405 tests have been administered in the participating schools, and it's up to the school and the superintendent or the non-public school. In addition to administering the test, as you know, there's been a distribution of tests, and about 121,000 of the tests have been distributed to schools, and of course also participating in the White House's initiative. The White House initiative distributed 5 million point-of-care tests to school systems, and last month gave you the results of how many had been distributed, and that's in the first bullet in the first distribution, where Baltimore City and then Baltimore, Howard, Montgomery, and Prince George's County had each received 12,000. In the following week, wanted you to know that additional tests were distributed. In this case, you can see Anne Arundel, Cecil, Talbot, Wycomico, and Worcester received tests. In the third distribution, you can see another 5 school systems were given tests. And then in the fourth distribution, this included the Archdiocese of Baltimore and then 4 more school systems. It's a lot of it is based on how many they're using when the requests come in. Meredith is the point of the contact at MDH. So for anyone, any school system who wants to get in touch with Meredith, she's very responsive and will work with the school system. So local school systems conducting test to stay, this has pretty much stayed consistent, with 4 saying yes and 20 saying no. Conducting weekly testing, as you can see, 6 school systems identify that they are conducting some sort of weekly test, and 18 are not. What are additional testing models that are being used. Some school systems say they have a site, and the students, educators would go to a particular site. Maybe it's multiple sites, but it's not at every school. You can see the systems that are doing testing for extracurricular activities. It could be athletics, clubs, band, and so on. Diagnostic testing, again, diagnostic is for testing with symptoms through the local health department or wellness centers. You can see that's Calvert and Caroline, and then voluntarily in various formats. We do always ask, what's the preventative measure? What's preventing you from doing some of that testing? One, of course, it is with the parent's permission. Then they must give consent. It is staffing. It is testing availability. It's resources. We know that schools are very, very busy and staff are very, very busy. So where are we with quarantine and COVID-19 data? So one of the things we wanted to say, there were no automatic triggers. All persons who test positive for COVID or have suspected COVID-19, instead of the 14, the 10, the 7, should stay home for at least 5 days, so that was additional guidance. And so here we have the data that we're presenting, that we present each month. We are looking for staff. I will say that the staffing is variable across the systems. So there is no common denominator that we can use that would be accurate for all the staff. All of the staff quarantines between January 25th and February 22nd, this is the delta, these are all changes, have decreased. The student quarantine, the percentages, so these are numbers from January 25th, last board meeting, to your board meeting today. You can see the numbers are down, and we have looked at the percentages. In this case, every school system has gone down for the percentage, from Allegheny 6.3, Anne Arundel 0%. There was just one system that had an increase, and that was in Somerset County. The next is the staff COVID numbers. Again, this is a change. All of the staff COVID numbers have decreased. This is with the exception of one, which is Queen Anne's County. The student COVID case progressions, again, percentages, hard numbers are down, and percentages are down. We have two systems that showed an increase. One is Somerset, and the other is Wacomico. Quarantine practices, we've pretty much talked about these. Who was doing the 5 days? Most of them are doing 5 days. That's 18 school systems. When I talked about it could be 14, 10, and it's reduced until they could use the 5 days. The middle group are using kind of a combination depending upon their needs. Now let's look at positivity rates. So the daily positivity rates, this is reported by MDH. You just heard from Dr. Chan. All of these positivity rates, now notice we track this, we're tracking some of this data more frequently for you. We're looking at it every week, from the first time we meet with Mr. Chaudhary to plan with the first state board to us giving you this data. And the data is going down statewide, down to 3.3, and January 23rd it was 14.8. All of the local school systems all have decreased with the exception of a slight increase in Allegheny County. And then, as we always do, just to give you the kind of look and feel of what the graph looks like, you can see the graph based on the data that we've provided you. The next is the 7-day moving average, the new daily average per 100,000. This is also by local school system. In every one of these school systems and statewide, the numbers are down. You can see the decreases And you can see at the height, January 23rd and 22nd, where they were. And again, data is going down February 3rd to 10th to 17th. Next slide shows this in graph form, and you can take a look, and we all look at the counties that we live in and where you are. The level of transmission, I do want to let you know, we're going to have an update at a slide later. I didn't update this particular one because the graph follows it. But from February 10th, where we had, so it was high, along February 10th, we had one substantial, and that was Prince George's County. And February 16th, we have 9 school systems that are at the substantial. So it's high, substantial, moderate, and low. Next slide is just the graph of what you saw in the previous slide, so you can see where we are with that. This is the percentage of the total population fully vaccinated, and this is not a self-reported. This is by MDH data. So the good news is this is all increased, and that's what we want to see. And eventually, and it will be leveling off, of course. But the percentage of total population fully vaccinated, as reported by MDH,